looking at is to get back to who we truly are. We're not looking backwards to look backwards to go to glory days. We're looking backwards to move forward. We're looking forward for the next generations to come. In a democracy, the majority rules. Very different, guys. And we are truly the idea of what a republic is. Number 3, we believe in true individualism versus collectivism. I want to get back to our founding document, the Declaration of Independence. The Creator bestowed you with individual rights of life, liberty, pursuit of happiness. In a collective, the rights are bestowed to the government, from the government, to dictate to who you are. If that's true, they can give you rights and take rights away. So where we started, where our premise is that the Creator bestows the inalienable rights which cannot be taken away, life, liberty, pursuit of happiness. The Declaration of Independence is a why document, why we deserve freedom from England, and how we run that as a civil government is the Constitution. The Constitution has 18 functions, Article 1, Section 8, of what their functions are. Please read them, because that's what we have to hold Congressman Burgess, soon to be Congressman Lawson, to. That is their employment agreement. With that, what we're bringing today, guys, about is health care. Health care has 3 main functions, well, 3 main debates I want to talk about today. Is it constitutional? What's in it, and how it affects us as a couple ways, as physicians, as businessmen, but most importantly, as citizens. How does it affect you as a citizen? How do you affect your decision you make for your family? Because there's nothing more sacred. And this is not to be, to be holier now being a physician yourself, but that doctor-patient relationship, because we're all patients. We all are patients. That is something that's crucial to us. So I'm going to give you a little summary of what's in the healthcare plan. How much is $90 trillion? The whole world's net worth right now, gross worth, is $70 trillion. These numbers are astronomical. There's a mandate in there that if you don't buy insurance in the first plan, you go to jail for 3 years. That has been gone, but there is a fine as an employer, as an individual. Also, a lot of the plans, there are 159 new agencies at this point counted to, and a lot of the decision making was decided on the Secretary of Health and Human Services. They're not even there. Of the 2,500 pages in the healthcare plan, there's 500,000 words. And for every page, there's 10 pages of regulations. Okay, those regulations will be done by unelected bureaucrats. So again, guys, this is a crucial decision on what's in there. We'll talk more what's in the plan. But at the core of it, again, I want to go back to what Founder's Truth is. We're looking for our children's future and their children's future. Who has the rights bestowed upon them? It's the individual. The individual gave the federal government a limited power to enact that, so we could do what? We could actually express our freedom of our American dream by itself and in that. So the question is, how do we make the best health care the world has ever seen better? Is it federal level, state level, or is it local level? Or is the government involved at all? I was reading some statistics. All 4 stages of breast cancer, 5-year survival rate in America is 84.9%. In England, it's 51.2%. Prostate cancer, it's 86%. England, 51%. The average CT machine in Canada is 10 years old. Here, everything's less than 3 years old. 17% of our GDP. But who puts a price on health care? The collective, who wants to know we're a cog in the wheel? Or you and you make a decision on your baby or on your grandma? That's what this fight's about. So what I want to do is, we're very fortunate that we have BJ's father brought down Congressman Burgess here. He was a practicing OBGYN. Hopefully be the ranking man on the new healthcare committee if Republicans do take over. So he'll have active input in what we do. Hope we eliminate the plan, but hope we do what we do with that. And hopefully, and BJ, as well as you guys know, he's a trained engineer as well as an MD and did an intern year at Duke in surgery. So he's also a small businessman, so there's aspects of that. So today's please is going to be not me talking, not just them talking, but all of us answering questions, because really the power is within us we've been bestowed on. Let's exercise that and make sure that our representatives do that so we can actually be free in the greatest country we've ever seen. So guys, again, thank you very much. Mr.